So firstly, you can see the patient's details by clicking on this icon here. You can update a profile pic. You can capture it from your mobile, from your device. Let's just upload an image for now. So we'll just upload a dummy pic for now. We can resize this image, reposition the image, and save it. Details will start showing up over here, like allergies, daily medications, etc. We can also add the patient's chief complaint. We can add the clinical observations here that we have, and we can then have a fair idea of how this patient is placed. Moving ahead, lower down, we have three basic charts. We have the personalized treatment chart, we have the dental chart, and we have the miscellaneous items. So let's first see the personalized treatment and miscellaneous items. So personalized treatment is for something that is not in the system, or it's a very trivial thing. So for example, say around tooth 4-6, okay, I have done a suture removal. So I'll enter the treatment. Okay, I can select the status, say I have now completed it. So I'll select done. I'll select the doctor who did it. So let's select Dr. Bosky. And any comments. That we would like to add. So this is for any treatment that you want to mention. You can just type in the details and save it all there. You can apply the cost as well, and that will all be recorded. Going to miscellaneous items, this is more like if you've given the patient, say, dental floss, okay, or any other medication or a toothbrush or something, you can just mention that. You can mention the comments, 2 packets. The date automatically gets populated, and you can add the cost if you charge the patient something for that. Okay, and this data will be saved over here. Now let's see how we handle the dental chart. The dental chart is actually handled from up here. So to do this, you just need to click procedures, okay? But before we go into this, we need to take an example. So I'm going to take an example of this lower 4-5 missing here, and we'll imagine that we need to place a bridge for this patient, and we need to place a zirconia bridge, okay? So let's see how we place a simple treatment plan like that. So we click into procedures, okay? Now before we go ahead, a few rules of engagement over here. You see these tabs, they all represent different treatments, but the treatments can be a finding or a treatment itself. For example, a missing tooth cannot be a treatment, it is always a finding. That is why they are coded in blue. Secondly, things that are coded in entirely in red, for example extraction, they cannot be a finding. An extraction is always going to be a treatment, hence they are totally in red. But there are treatments like a RCT, which can be a finding and a treatment. So if you click on the blue side, you are going to be clicking it and applying it as a finding. If you click on the right side, you will be applying it as a treatment, okay? So let's continue with our example. So say we had a missing tooth over there in the 4-5 region, but we are going to place a crown and bridge. So either which of whatever we select, we will be able to do both of them. Let's see how. Let's say I'm going to select missing teeth now. Then I get a list of what all treatments I can do for a missing teeth. If I don't want to do any treatment, I'll just select apply selection. But we've decided that we want to fabricate a crown and bridge, so I'll go ahead and click that. Also, we've decided that we need to do only a crown and bridge. We don't need a RCT or a post or something like that coming. So we select only crown and bridge, and we know that we've decided to go in with the zirconium crown and bridge, right? So now once we've selected that, we just need to follow these trail marks set. So you can see this highlighted tab here. Select teeth that are missing if any, and then click it done. So we know 4-5 was missing in our case. So we are just going to click it once, it disappears, and we can click it done, and or go to the next one manually. Now select if you have any teeth to extract. We do not have any teeth to extract, so I'm directly going to click on the next tab, which is select teeth you plan to place zirconium crown and bridge on, and then click done. Also, in addition to that, you see that we have an option of asking us whether this crown and bridge is going to be splinted or not. So now since it's a bridge, we know we have to splint it. So we're going to click on yes. Before applying this treatment, we'll also take a look at the other options here. So I have the options to reselect which doctor is going to handle the case, okay? We'll keep it on the same for now. We can enter comments if any, like say, I want a CAD CAM prosthesis for this patient. I can just mention that in the comments. I can select the price. We have a preset price list. You can customize your price list so that you don't have to again and again change it. You can say now I'm going to change this from 5,000 to 7,000, and that will be applied. And I can click on this to say that I want to save these changes to my price list. Okay, so that is automatically going to get calculated. Also, I have the flexibility to set up 5 different price lists in my account, depending on the patient or implant or any which ways. Okay, so if whatever I've selected, that price list will automatically show up. And now we'll go ahead and apply our treatment of the bridge. We selected splinted, so we know we're going to place it across here. So we just click each time, and you can see that our bridge is ready. The AI of DrOrbis automatically identifies where you had initially placed a missing tooth or an extracted tooth, and automatically gives a graphical representation of that tooth as a pontic and a bridge on the adjacent teeth. So now graphically it's very easy for you to recognize that it's a crown and bridge, that's a zirconium crown and bridge done in this region. Now also we have a key over here. This key represents 4 things. You can see that our treatment here has a red outline because we've just created a treatment. We also have a yellow, a green and a blue outline. So the yellow is to indicate if you started with the treatment, the green will indicate that we've completed the treatment, and the blue will indicate that it's a finding. Now all we need to do is click on the individual treatments and change its color from red to blue, and click it again to take it back from yellow to green, not blue, sorry. So now once we do this, we are indicating that we have completed with the treatment. Just need to click it, and this is for our reference. If by mistake it has happened, again just click it and take it back to the same state. You will also see that once we've done this, automatically everything has been populated in our dental chart. We can see the zirconium crown and bridge on the 4-4, which doctor, the notes that we wanted to enter, CAD-CAM. If we had some notes to enter for the missing tooth as well, that would have shown up. We have the prices calculated, and it's automatically set with the creation date, modified date, and all those details are set. Okay. Your bill is also ready, and say you want to add an installment now. Okay. So you can just add an installment of say 2000 rupees. Any notes if you want to add there, treatments covered. And just click on save. You can view receipt or now as soon as you do this, the patient will receive a message of the amount that he's paid. Okay. And so will the doctor. So the message itself confirms with the doctor and the patient that yes, there is a payment done. You don't need to really print out any bill for that. And that is how the system helps you.